Good afternoon. I'm Dr. Ozkan Sayan. I work in hematology in the medical clinic. I want to overview the topic about lymph nodes and leukemia. Leukemia, as is known, forms in the bone marrow of the human body and spreads from there. That is where it originates. Lymphoma is a disease that forms on the lymph nodes, and they are generally felt to the touch. Also, I want to take your attention to the fact that leukemia can be a chronic disease. Those sick with leukemia usually come to us with the chronic type. After our examination, we can track blood clots, electrocytes, platelets. Generally speaking, they create congestion, and platelets form in the human body in the vessels. In simple terms, a lung infection will manifest. Because of the decreased amount of electrocytes in the blood, the sick come to us quite weak, like the anemia condition. The sick will show an enlargement of the spleen and liver, as well as bleeding nose and gums. A sick person will feel lost, tired, and aloof. Bone ache, joint ache, loss of weight, temperature jumps, nocturnal sweating. What causes leukemia? I want to tell you about it now. It manifests due to high emission, therefore radiation. For example, the time when bombs were dropped in Hiroshima and Nagasaki, many people were observed to have this disease because of the radiation. Other reasons that cause this disease are virus groups and chemical substances that cause radiation which people use in their daily life. Risk groups include people who have gone through chemotherapy and take medication as part of their chemotherapeutic treatment, and many other factors that cause leukemia. I want to shortly explain what might provoke it and how it begins. So, in the way that you can understand, many hematological diseases could cause leukemia. The leukemia disease is divided into two types. I want to give you a short description of them both. There is a leukemia that develops very quickly, rapidly, through a very short span of time. The other leukemia subtype that takes months or years to develop. Chronic leukemia, as a rule, lasts years. In order to recognize what type of leukemia we face, we count the number of electrocytes and platelets. We go through biopsy of bone marrow. We perform a cytogenetic test and so on. Many tests are carried out, including investigating a person's age and condition. After a cytogenetic analysis, we understand what type of leukemia we're dealing with. We predict the severity of a contagion of an infection, whether it has been there a while or started recently in the patient. Whether it is vanishing or advancing, or whether all signs are part of one infection that matured over time. We check the state of the bone marrow, and only after this step, we prepare the patient for the procedures. All of this is done so we know whether it is recessionary, repeated, or chronic. That is why it is important to know all these factors. This gives us insight how we need to treat the patient. In the recent years, like in the rest of the world, all of us use immunotherapy. What must the patient know after a leukemic treatment? So, after the treatment, we have a conversation with the patient or their family, discussing the medication to be taken after therapy and what side effects might come up due to the medication. In the 3 or 4 years after treatment, the patient must be observed by us. We must control the state of their health. Now we turn to the subject of lymphoma. This disease also has 2 types. Every type includes within itself several subtypes. For example, in this disease, there is a feeling of bumps underneath the skin fabric. They can be on the neck, in the armpit, and so on. There may be a rise in temperature and weight loss. For example, in 6 months, the person may lose 10 to 15% of their weight. The ill have constant tiredness, weakness, itchiness, loss of appetite, very frequent cough, difficulty breathing. But on its own, it passes painlessly. Usually, it can be noticed in finding bumps under the armpits, on the neck, and in other parts of the body. Lymphoma has several subspecies. To go through all of them would take a long time. I will demonstrate some examples about some of the subspecies, so you can understand what it is that we are talking about. For example, the frequently found follicular lymphoma, a subspecies of lymphoma, and Moncelli lymphoma, and others. There are many subspecies of lymphoma. We mentioned some of them. There are the type of cases that sick patients come to us with. Symptoms of the illness are an enlarged spleen. I will repeat myself. Enlarged liver, stomachache, a high body temperature, enlarged lymph nodes on the neck. Lymphoma and leukemia share a lot of similarities with each other. Just like the latter, it can be provoked by a virus. The illness can lead to a chronic infection. Lymph nodes can be singular or multiple. Just as it would be in leukemia, this may lead to platelets in bone marrow. I will repeat again. Radiation is a common factor. A person who has gone through chemotherapy is more likely to get sick with it. Smoking cigarettes too can lead to lymphoma. I will also tell you how it may be recognized. Bumps appear in different parts of the body. They do not hurt when touched. Neither as a singular or a cluster does not matter. There is no pain felt from them. To understand what is going on, we run a biopsy of the fabric. We go through with an immunohistochemistry, and only after running all the procedures, we find out what kind of lymphoma it is, or what subspecies it is categorized under. Using a tomography, we investigate and find how fast it is developing in the person. Only after this step, we give the patient the approved treatment and go through with our chemotherapy. Using anticorrosives, we treat the ill. We run not only chemotherapy, but actively engaged immunotherapy. I will repeat myself again. After treatment, in a period of 3 to 5 years, we keep track of the patient. We take the necessary actions so to avoid a recession and a repetition. I am grateful to you.